Quebec's health minister is refusing to back down from his new law that imposes a salary structure on the province's doctors, even as criticism of the law grows. Now, medical specialists are challenging it in court.
We're afraid that some doctors are going to leave, are going to retire early, even if they can be fined for it. And we're afraid that young doctors or students won't want to come to work in Quebec.
These are big changes that we're asking them. I understand their reaction, and that's their right to do what they take this legal procedure. But I think you will understand that I will not comment on it more than that. And secondly, my job is to protect the patient. That's what I'll do.
Some experts say the law has reasonable goals, but that the government's methods are way off base.
We're not going to solve this by cramming, holding a gun to people's heads.
The law ties some of doctors' pay to performance targets. The idea is that more patients would get regular access to a doctor. But those targets are collective. So unless an entire group of doctors in a given region meets a global target, none of them would get a bonus.
This notion of the collectivity being, individuals not benefiting because the collectivity has failed somehow in some vague, amorphous way, it doesn't really make sense.
Even an expert the government consulted when it drafted the law says it's deeply flawed. He says the government's targets are unrealistic.
It's just like suddenly every physician would have twice the room for rostering patients and see them just as he was working half-time. It's not possible. So since it's not possible, especially not in a very short-term period, it's not going to work.
He says the law will probably achieve some of its goals, but that won't necessarily mean better care.
Certainly not in a way that will please neither the doctors nor the patients, that's for sure. But I think it will have its effect. So pretending that the law won't do nothing is certainly wrong, but it will do the things it will do in the wrong way.
The law also penalizes doctors who, in groups of 2 or more, make a concerted effort to disrupt the system. It's not really clear what that means, and the government is downplaying it. But some doctors see it as a gag order that would punish them for speaking out or even for retiring or moving to another province.
Well, I think the worst part is, people who complain about it risk being fined, right? So that's, if this is a discussion we need to have and to have publicly and loudly. And if the government really believes that this law is good, then it should be willing to listen to the discussion and have a fulsome debate about it.
The minister says there's still some wiggle room on some of the financial details of the bill, but on the main points, he says he won't budge.